Okay, it is 8 o'clock. Hi, Dr. Anjali. How are you?
I'm very well, Helen. Nice to see you.
It's good to see you too. So this has been one of our most subscribed to webinars, which just shows the importance of and prevalence, I think, of skin and stress and how much we're all impacted.
Yeah.
Um, So I'm really delighted to have you join us for one of our expert series. So by way of introduction, my name is Dr. Helen O'Neill, and I am the CEO and founder of Fertility. I'm also a lecturer in reproductive and molecular genetics at University College London, where I lecture both master's students and medical students about reproductive science and women's health. And Dr. Anjali is a consultant dermatologist, an author, founder of Self London, which is an incredible clinic in the heart of London and has won multiple awards. Really, you are one of the most widely recognized voices in the acne field. So I see you all over the press, contributing to different articles, giving your expert opinion, but also you're very much recognized for your ethos that bridges the gap between traditional medicine, medical dermatology, beauty, um, cosmetic medicine. It's really amazing to see your energy and your passion, but also your integrity that you've always maintained for so many years, and yet still maintaining that hands-on clinical experience. And you've encapsulated all of that in your book, The Skincare Bible, the link for which we will share with everybody after this. And it's essentially a manual, is that right? Like that helps the consumer to really just navigate the skincare industry, which can be quite confusing.
And massively overwhelming. Yeah.
Yes, exactly. So um, I'm excited to say that you also opened your clinic in 2023 and has already won lots of awards for this clinic. And it just shows your dedication to not just one aspect of your medical profession, but incorporating lifestyle, incorporating all of the different research and clinical aspects. But more importantly, you really have invested in some of the most modern technology within this clinic, and that is really what gives it quite a unique feeling, is that you are so well read, well spoken, and well educated on all of the new technologies, and you have implemented them in your clinic too.
Thank you. That was a lovely introduction.
Well, I do enjoy you very much. So to begin with, just to take the first 5 minutes, selfishly, I'm going to explain the relationship between how we got together,
Mm.
how we are very much symbiotic in terms of our interests, but also how we seem to have met in the middle. And so I'm going to just share the same slides I had a second ago, but to go through and say that fertility is essentially here to create a data set that didn't exist. When we started to build fertility and wanted to build out diagnostic solution for different gynecological pathologies, we were shocked, devastated, disappointed to see that actually the data to inform so much of the clinical guidelines really just didn't exist. And so this has been a very big research project to me as a scientist, and a passion piece to try and build the data that just doesn't exist. As many people will know, we live in a world that is built medical solutions with one side, and that is the male side, and we are not, small men. And so creating a unique data set that takes into account the wonderful complexity of our reproductive cycles, of our hormones, of our of every single bit about our unique physiology, anatomy, and genetics is very important. So that's essentially why we wanted to create fertility, to ask such a comprehensive health questions. But at the start of our health assessment, we will ask you what brings you here, and that helps us to really build out the clinical journey for you. We'll ask questions about symptoms and biometrics, menstrual factors, lifestyle factors, and previous medical history, because all of those things are really important to getting you to an informed clinical diagnosis, and it allows us to tailor the reproductive hormone test that we will do for you. Oftentimes people think fertility is just fertility. It's not. It may have started as that. It's actually much more of a broad general gynecology screening tool that helps us to really assess your gynecological health from menstruation through menopause. And then what we do is once you've had your blood test, your tailored blood test, you'll be brought through your report, which has a gynecology written report, including all of your results, every single hormone explained. Now, through that health assessment, we have a number of questions that we ask. And so we are really at a point where we've built a significant database, one of the largest in the world. And our mission is to share this information and the findings so we can actually make a difference. So that first initial health assessment has been done by over 400,000 women. So what that gives us is the most modern, up-to-date database on the modern woman, on our lifestyle factors, on what our symptoms are, what the prevalence of reproductive pathologies and symptoms are. And what we see through the people who have done a test with us is that actually 60% find out they have a hormone imbalance. And because the symptoms relating to hormone imbalance are very insidious, we often just think that this is who we are, and we don't realize that our hormones are playing a role in how we feel, in how we look, in how we bleed. And so we're very proud of the fact that we have given people results indicative of diagnosis, and moreover been able to provide them with onward necessary care, whether that's an ultrasound scan, whether it's fertility treatment, IVF, whether it's egg freezing, whether it is surgery. We are really catering to all needs. But one aspect that we notice as a really prevalent symptom is around skin and hormonal acne. And that is why we have really teamed up with Dr. Anjali, because she is such an expert in delivering incredible care. And we wanted to just provide some education this evening. And I am your willing student. I'm usually the lecturer, but tonight I'm your student. And previously we had an event together, and I honestly thought in 30 minutes I've learned more from you than I ever would have from any other source. So we're really lucky to have you this evening, and hopefully lots of people will ask questions and we will get to as many as we can too. So this data set that we're building, understand that this is data for good. We are really building this with the overarching aim to really fuel ongoing research. I am a research scientist. It is my passion to do research for good. And this is the way that we are building this, is through really actively engaging with healthcare professionals who are experts in their field to say, what would you want to see from this data set? How can we improve current diagnosis times, clinical services through analysing this? And we've already seen that so many of the conditions that we can screen for, we can do so with 98 to 99% confidence, and you haven't left your house. And with the current waitlist to see gynecologists in the UK, this is a very profound thing that we have managed to do. Then one last plug for the fact that we are publishing a reproductive report. This shows you the reproductive report that we published last year, showing data from 122,000 women and set out into different pillars around lifestyle factors, Black women's health and the disparities in that, which we published in a separate larger report called the Inequality Report. Please download these. Are a freely available resource that we want to let you know that we are sharing our data as we go, in the hopes that we can do good with this data. And from there, I will be quiet and I will get to Anjali, and just to say that, you know, one of the contributing pillars of our next reproductive report, which we will have a launch webinar for that in the next 2 weeks, it was stress. So stress seems to be one of those things that is really haunting all of us. We live in an age where we have access to almost everything at our fingertips, instant access, information, people, things, and yet our lives are so hectic and busy. And in our health assessment, we ask, how are you feeling? And the answer is, you know, the options are calm, relaxed and confident, neutral, stressed, or completely stressed and overwhelmed. And the majority of people, almost 63% of women, say they are either stressed or completely stressed and overwhelmed. And this is very much indicative of how they feel in their hormones and how it's reflected in their symptoms. We see higher numbers of symptoms. I'll get into this in our webinar about the report, but that is something I think that our stress, our skin, our hormones are inextricably linked. Um, in your own clinical practice,
Mm.
I think I've heard you say before that even in the last few years, you've seen a change in people and their symptoms that they report, especially pertaining to stress.
Yeah, absolutely. And I think pandemic lockdown has certainly highlighted that
Oh,
shift.
I'm so sorry. I
Yeah.
forgot to record. Oh, it is recording. I'm so sorry.
Oh,
Somebody put a question. God, I'm always bad for.
okay. No, that's good. I think there is no way of escaping stress in modern day life. I'm not surprised to hear the statistics that you've just said. And the truth is, when it comes to skin, for example, we know for a fact that chronic inflammatory skin conditions, so things like acne, psoriasis, eczema, rosacea, they're the big four. They will absolutely be triggered by stress. And then guess what happens? Your skin gets worse because you're stressed. Then you get stressed because your skin gets worse. And it can become a very, very vicious cycle between stress flaring up skin and vice versa. So one thing I am so keen on is, I mean, quite frankly, I would put everybody into therapy if I could. But I think if you have got a chronic skin condition that can be triggered by stress and you recognize that, it is so important to work with a clinical psychologist who specifically specializes in that. And to be honest, that's one of the reasons when it came to putting the clinic team together, I wanted a clinic psychologist in-house because we recognize that everyone is stressed. Everyone is finding that stress is impacting their day-to-day and their skin.
Wow. It's hard to actually build ways or solutions to avoid stress, I think. Maybe recognizing an outlet, but maybe let's talk about how I see a question relating to like stress and exercise.
Yep.
So is that like are there ways physiologically you feel that perhaps exercising might reduce our stress and therefore reduce the impact on our skin?
That's a good question. So I think a lot of this comes down to moderation. And I'm never keen on extremes of anything. Exercise is incredibly important. And a lot of people do find that not only obviously is it good for your heart health and your general health, but it will reduce stress levels as well. But if you are one of those people that is exercising all the time, your body is also not getting the nutrients that it needs, and you fall into a pattern of over exercising,
Mm.
actually, that in its own right can cause a hormonal shift and a balance shift. So, like anything, too much of anything is probably not that great for you either. It's about keeping it in balance. So, my answer there would be absolutely yes. I think exercise is vital for good skin health, for good general health, provided it's being done with appropriate periods of recovery, depending on what you're doing.
And I think listening to your body in those
Yeah.
instances as well. So often we fight through what we again, you can tell I'm obsessed with the data because what I feel is that it gives an opportunity to listen when so often we are unheard, right? We could be screaming into the abyss and we're not heard and we're dismissed so often and so readily. But when we ask sometimes about symptoms, firstly, what's strange is when we ask sometimes, have you ever been diagnosed with anything?
Mm.
We have a lot of different conditions, but sometimes the answer is no, but I suspect something's up. Actually, quite a lot of people say, no, I haven't ever been diagnosed, but I do suspect something's up. And they're almost always right about that.
Mm.
We have an innate ability to diagnose ourselves because we know when we're not quite right. And yet we have a bigger ability to self-dismiss and not check out our symptoms, not to check out our hormones. It's one of the reasons why I'm so grateful that we can, that this test can be done when you're in bed, the assessment. The test can be done from your home, and then you can be referred to onward clinical care, but get a diagnosis from it. Do you find that, I think you've said before that many of your clients presenting are women of reproductive age,
Yeah.
but we know that moving throughout even a monthly cycle, we see a huge shift in our hormones. And obviously, we see cyclical hormonal acne as well.
Yeah.
Can you just talk us through cyclical hormonal acne?
Yeah, absolutely. And I mean, first of all, it's incredibly common. So up to 60% of women will say that they notice fluctuations in their skin, particularly in the second half of their menstrual cycle. So the luteal phase of your menstrual cycle. So this is the time where your progesterone levels are rising. And progesterone has got effects in the skin very similar to testosterone. And even women have testosterone as well. And what these hormones do is they increase the size of the oil gland. They make the skin more plump, more juicy, because your sebaceous glands, your oil glands are working in overtime during that second phase. So it's incredibly common for people to say, actually, a couple of days before my period is due, I'm seeing changes in my skin. I'm seeing blackheads. I'm seeing spots like acne because of that progesterone peak that you're getting premenstrually.
And is there anything that can be done to kind of combat that? What are the things? I mean, yeah, I always want to know, like, so what do we do?
So the skin cycle is long. The skin cycle is roughly every 28 to 32 days. And despite the fact that we're sold this idea that if for 2 weeks of your cycle you do special skincare and that will get rid of your spots, unfortunately, the skin doesn't work that way because a lot of the spots that are coming out probably formed as blackheads about a month ago. So actually, it's more about a consistent, reliable skincare routine to make sure that you're exfoliating, to make sure that blackheads aren't forming. And if there is a hormonal component to it, so I'm sure we're going to come on to discuss conditions like polycystic ovarian syndrome, for example, there are also medications that a dermatologist is able to use to help rebalance the hormones in the skin. So that's not things like giving you the pill, which is obviously giving you female hormones, but medications like spironolactone, which work by reducing androgen hormones in the skin. So they're things like testosterone, dihydrotestosterone, which we have as women, but are the culprit hormones in the skin that can drive acne.
So it's a good idea if you're noticing these skin changes to have a look at your testosterone levels, or if you suspect that you might have PCOS to get this to get that checked.
Yeah, absolutely. I mean, PCOS, I know you and I have talked about this separately, but it's massively underdiagnosed.
It is.
It's hugely common. It affects, about 12% of women as
Yes.
far as rates go. And I think you said your database is actually higher than that in terms of
It
the
it
figures that you
is. It's
have.
funny. It's exactly 10% of people who say they have a diagnosis, but
Yeah.
then it's almost closer to 14% because we can diagnose it. So
Yeah.
we actually give a clinical diagnosis of
Yeah.
PCOS because we can tell from the raised AMH and androgen levels.
Yeah.
And therefore it kind of makes sense, the symptoms that you see relating to hormonal acne. Um,
Yeah, that's right. And I think it's one of those things, if you don't look, you don't find. And if I see somebody in clinic that has got resistant acne, they've developed adult acne for the first time, having had no issues at all. They've got a lot of acne, particularly on the lower part of the face. So around chin, neck, lower part of the cheeks. Often that can be an indicator. So it's also really important then to start kind of tracking periods at that stage and looking for other clues of PCOS. So things like increased body hair or facial hair. And all of those are little clues that we get to think, actually, we should be checking the hormones out. Because if you don't make that diagnosis, what you are not able to do is give somebody a long-term idea of what their acne might be like, but not just their acne with PCOS. It's also about fertility. It's also about insulin resistance. It's also about making sure that you're doing everything to improve their metabolic health as well.
Absolutely. And I think so often we did a study asking people how they got their diagnosis of PCOS. And for many, they didn't realize what stopped you is what we asked. What stopped you getting a diagnosis? How long did it take you? For many, they didn't realize their symptoms were indicative of something wrong because
Yeah.
so readily told, to tolerate and put up with our symptoms. But we also found that there was this huge relief around getting a diagnosis because
Yeah.
it meant you had something tangible to go with. Like I often say I had somebody come up and hug me because they said I got a diagnosis of PCOS. And I
Mm.
was like, I'm so sorry. But they were like, no, I've spent 5 years just trying to get answers. And so often the focus of the conversation is solely on fertility.
Yeah.
Do you get pregnant? Are you going to have a baby? And therefore it takes away from um the other aspects of our life that it impacts, and skin is a huge part of that. Because it knocks your confidence, it just kind of knocks your routine as well. So there's definitely PCOS is one of the things that it's good to get a diagnosis of PCOS. It's good to get your hormones checked and make sure that you can know what your hormones are. You spoke about kind of some medications. Um, can you give us just a little bit of a run through on what those medications would be in the absence of PCOS, or even with
Yeah.
it for acne, and what would be the reasons why we might actually go down, like firstly getting your hormones checked to look for the hormone link between your skin, then what are the things we could do naturally in ourselves, and then what is the trigger point that you would say is okay, it's time to try a medication for your skin?
So I think there's a couple of things you have to look at. So obviously the hormone levels themselves, but I think the second thing actually is what is the extent or the severity of that acne? So is it just on the face? Is it on the back, the chest, the shoulders? The third thing is that acne leaving marking or scarring? So 20% of people who do have acne will get permanent scars or indents or small craters in the skin. That's what we really want to prevent. So if there is scarring, if the extent, the severity, what the hormones are like, but in addition to that, how much is that acne impacting your day-to-day and your mental health? Because if you are somebody that is finding actually you don't want to go out, you don't want to date, you can't leave the house without makeup, you feel like you've got to wear makeup to the gym, it's really holding you back in that way. All of those are things that I would take quite seriously in terms of what treatment I would go for. Now, ultimately, there's lots of ways you can get to the same endpoint, which is clearance of that acne. And I think a lot of it goes on what a patient feels comfortable having done. The basics, absolute basics, are your skincare routine and potentially sort of ingredients that can help with exfoliating the skin. So ingredients like salicylic acid, benzoyl peroxide, niacinamide. These are things that you can buy over the counter in things like toners, in face washes, in moisturizers. And most people, before they actually see a doctor, will probably try a few things with their skincare routine. And then if that's not working, the next step probably would be to see a GP or someone like myself. And probably what I would do is I would at this stage add in a vitamin A cream, like a retinoid cream that can help with acne, particularly if somebody is not trying for a baby or if it's not immediately on their radar. So retinoids should not be used whilst you're pregnant. They're fine if you're breastfeeding in limited areas. But, again, all of that needs to be taken into account. If you start a new skincare routine, you are not going to see a quick fix. It is possible that things can get worse before they get better. So you can get a purge or a flare up when you start a lot of new things. And it takes about 12 weeks to know if a routine's going to work for you or not. But let's say you've done the at-home skincare, you've done the prescription cream. Where do you go from there? So then this is where a lot of other factors come in. So it's, do you want to take hormonal treatment? Some people don't. They don't want to go on the pill for their acne. My clinic is full of women who got put on the pill when they were 14 or 15 years old. They've been on the pill for about 10, 15 years. It's masked the fact that they have acne. The minute they stop it, their acne flares up. So I'm not going to put somebody back on the pill when that's what they want to do. Like, if you want to come off hormones, it's not a logical choice, but it is something that's in our guidelines. We can also offer oral antibiotics. I don't love using oral antibiotics for female adult acne. I don't think it's good for your gut health or your general health to be on antibiotics for long periods of time. I also don't think that you get a good clinical result. So what you find is people will clear whilst they're on it, but the minute they stop, you get recurrence. And then what? So you're back to the initial issue again. But it's on the guidelines. So all of those things are there, but in practicality, the things that I tend to do more of in clinic are if somebody is not planning pregnancy and they are looking for an approach that does not involve taking the pill or antibiotics, I use a lot of a medication called spironolactone. So spironolactone is a drug that's been around since the 1950s. So we've got decades of safety data on it. But when the drug first came onto the market, it came onto the market for a completely different reason to acne. And it's actually used as a diuretic. It's a blood pressure tablet that's used in elderly patients to help you pee out your excess water weight. But like lots of drugs that come onto the market, they come on for one thing and then you realize they do a whole host of other things. So interestingly, the reason we figured out that spironolactone worked for acne is it was given to a bunch of women with PCOS who had high blood pressure to bring their blood pressure down. And what actually happened was it did nothing to their blood pressure. But what it did do was it fixed the acne that was associated with it. So then people went back to look at the drug and think, what else is it doing? And what the drug is doing in the skin is it's reducing the androgen hormones. So it's reducing testosterone and dihydrotestosterone in the skin. So it's very, very good for cyclical acne, flaring premenstrually, particularly on the lower part of the face and the neck. So that is an option. Other options, if people
And
want to go,
is that a full term that like you're put on is it a short term, long term, forever,
good question.
ongoing medication?
Yeah, so it takes about 3 months to work. You do have to play around with doses a little bit, so titrating doses. It can take a little bit of time to find the right dose for the right person.
And is
You
the
can
dose dependent on their testosterone levels and therefore how much you're trying to suppress that testosterone?
So, interestingly, I went to the American Academy of Derm meeting in March earlier this year, and one of the papers that was presented was about how women with PCOS do usually need higher dose of spironolactone. And it's not surprising if one thinks about it. And certainly in clinical practice from experience, I know that, but it's quite nice now to have that kind of data
Yeah.
coming out to support that as well. Now, the thing with spironolactone is you can't get pregnant on it. So it's not suitable for somebody who might be trying to conceive or somebody who isn't necessarily got it in their immediate radar, but wouldn't be like, I don't know, sad if they got pregnant tomorrow. So one has to ask these questions to figure out if the drug is suitable or not. The other thing is, if it does work for you, it is a bit of a long-term treatment. And people usually do get good results, sort of being on it for 12 months or 18 months. It's not one of those things that you do it for 3 months and then you stop. The results are kind of ongoing and the results usually get better with time. So it's not suitable for everyone. And that's what one needs to figure out. Now, if somebody, sorry, you're going to say.
No, it's still it's so hard because I think I think we're all guilty of wanting instant results. Like
Quick
we
fixes.
are, we're the instant gratification generation, where we can order
Yeah.
something and it will arrive. And so the idea of needing to wait to see if something works for 3 months is actually quite hard.
It is, it is. And I think that's why I always say at the beginning as well, it's not going to be a quick fix. And I'd be lying to you if I said to you that I could fix this overnight because I can't. I know it's going to take time and I know there is a risk that things might get worse before they get better. But there are drug-free options as well now. It's very exciting that we now live in an era where we actually have some options that are available to us that weren't even 6 months ago.
Yeah.
So we also now have a laser called Aviclear. And it's a laser treatment that works essentially by zapping the laser in the areas that you have the acne. So you can use it on your face, your chest, your back, or your shoulders. But because you're not taking a medication orally, it's got next to no side effects, and it works by shrinking down the size of your oil glands.
So
And if
this is a non-medication route.
Exactly. So suitable for somebody that might be having fertility treatments, suitable for somebody that doesn't want to take oral medication, suitable for somebody that can't take oral medication. There might be contraindications as to why that might be appropriate. So essentially, it's a drug-free option that has been licensed for the treatment of mild, moderate, and severe acne. So you can use it across all acne types, and you can also use it in all skin types. So certain laser treatments historically had to be avoided in the darker skin tones, so particularly in Black and Asian skin. And Aviclear is safe to use across all skins. And it's 3 treatments, 3 weeks apart. And the results, again, get better as time goes on. So you do have to be a little bit patient with it.
Wow, that's amazing. So that's at least now we've got kind of like the pre option, which is, over-the-counter skin
Yep,
creams or whatever it is. Then there's the medical option, and there's the non-medical but clinical option
indeed.
of this laser that you have. One of the questions we get asked about, in addition to acne, is about oiliness. So oily
Yes.
hair, oily skin. What are the things that causes, or are they the same things that cause oily skin versus acne? Or is it your ability to, I don't know, is it your pore size?
No. So actually, people who have got acne-prone skin or oily skin naturally have more prominent pore size.
Okay.
And so that's one thing that's a given. So if you've got dry skin type, so if you've got eczema, for example, or psoriasis, you probably will find your pores are tiny. But if you are oily, you will find your pores are large. So that's one thing in terms of skin types. But the second thing is, for all of us, as we get older, pore size does get more enhanced and more noticeable with age. And the reason for that is because we have collagen, the main protein that gives our skin its support and its structure. And these collagen fibers are supporting essentially where the pores are. But as we get older, the collagen fibers start to disintegrate. So the scaffolding is coming apart. So the pores sink deeper. So pores do look more prominent with age. And pores are usually most prominent on the nose and on the insides of the cheeks. That's the area where you tend to notice it the most. But to go back to your original question about oiliness, oiliness is usually associated with, again, either high levels of androgens, so testosterone, DHT, progesterone. So for example, if people have fertility treatments, if they're going to do something like, let's say, an embryo transfer, you get given very, very high levels of progesterone. It's not unusual for people to find that their acne might flare up at that stage, or they get lots of blackheads in their skin at that stage. So there is a hormonal link there, but often oily skin goes hand in hand with acne-prone skin.
Okay. And then I guess two further questions from that. Is how, or are there any recommendations from like moderating higher testosterone to try and combat through diet?
So first thing I'll say is just from an acne perspective, the degree of high androgens you've got does not correlate to acne severity. So you could have slightly higher than normal testosterone and have the worst acne, and you could have super, super high levels of testosterone and you could have mild acne. So there isn't actually a direct correlation between androgen level and acne severity, which is quite interesting.
Yeah, you
It's
would assume the higher the testosterone, the higher the acne.
Yeah, it's interesting. And when one looks for sort of diagnoses such as PCOS, for example, when you look at like the dermatological signs, the signs that we see in our skin and our hair, the most sensitive sign for diagnosing somebody with PCOS actually is body hair. And if there is increased body hair, it's often a very, very good marker, more so than acne itself, actually. So that's just one of the other things that we would ask about
Yeah,
or
you mean
look out
for
for.
diagnosing PCOS?
Yeah,
Yeah.
absolutely.
Yeah, it's in the guidelines that you would have, especially facial hair. And I think, and it is worth noting because many people don't know that actually laser hair removal for PCOS is available on the NHS, even though the time was going to be quite probably
Yeah.
excessive to wait. And is that why hormonal acne tends to present itself on the jaw, chin, and lower face? Is it just the prevalence of?
So it's interesting, actually. So if you look at the clinical trial data, it's actually quite mixed. So you have some papers that suggest that there are higher levels of androgen receptors potentially in this lower part of the face, which is why women are more prone to it. But then there are other studies which are quite conflicting and say that's not the case. So I think the honest answer is I'm not sure we know the reason why, but there's absolutely no doubt that you see what we call U-zone acne in adult women as opposed to T-zone acne, which we see more commonly in teenagers.
And is there a correlation between if you, let's say you did have this excess hair or hirsutism removed, does that impact or help or reduce this U-zone acne?
So hair itself and hair removal itself probably will not reduce acne production. There is another condition that's associated with PCOS called hidradenitis suppurativa. It's where you can get these really painful boils in your armpits, in body folds, essentially. So sometimes underneath the breasts, tummy folds, groin area. And in that particular case, actually laser hair removal can help reduce these lesions of hidradenitis. But with acne, there's no real data that shows that if you get laser hair removal done, your acne will reduce.
Interesting, very interesting.
Mm.
Okay, so we talked about menstrual cycle and the fact that our hormones change throughout our menstrual cycle, and therefore we can be more prone to cyclical acne and cyclical breakouts. But we know categorically that we have these different reproductive life stages. So you've mentioned even going through fertility treatment, which isn't a reproductive life stage, but certainly almost takes a given cycle and amplifies it. And so therefore you're going to see things really exacerbated during a fertility treatment cycle or an egg freezing cycle. But as we get older, our menstrual cycle changes, it shortens, our skin changes as well.
Yeah.
Do you want to talk a little bit about the later reproductive life stages, whether it's just even pre-perimenopause and perimenopause and menopause, to just say what we can really anticipate and what's the biological thing that's happening?
Yeah. So I think probably if one looks at kind of perimenopause, so anything from like sort of early 40s, I kind of feel like I'm in that stage. What happens to us as women is our estrogen levels start to decline. And estrogen is a really, really important hormone in the skin. Our skin has estrogen receptors in it. So one of the things that happens sort of over one's lifetime is when you start going through perimenopause, some women can develop acne for the first time. And the reason for that is estrogen is starting to slowly decline, but our male hormones, our testosterone, DHT, are still staying relatively constant. So the difference or the ratio between our male and our female hormones has changed. And that relative imbalance between the two can trigger acne for the first time. So that's one change that people often see. The second thing that can happen is the skin can go the other way, and you might suddenly start getting dry skin having had acne your entire life, because those falling levels of estrogen is there for hydrating and plumping the skin. Some people can start getting dry skin. So that's the second thing, and may have to switch to products and skincare things that they were able to use 5 years ago, but they can't use now because their skin is too sensitive. And they find that you put products on and you're like, oh, my skin's dry, it's itchy, it's sensitive. It never used to be. So that's one thing that we do see. And then by the time that you get to menopause and postmenopause, if we assume no HRT, so at this stage, estrogen levels have dropped quite significantly. It's very, very common for skin conditions like eczema, like rosacea, to get worse over that time. And that's partly, again, because estrogen is so important for the skin and hydrating it. The skin is no longer able to do that. The skin becomes thinner. It can't cling onto moisture in the same way. So dryness becomes super common. If you do go on HRT and that HRT contains progesterone, back to what I said earlier, some people are quite progesterone sensitive and they start getting acne again the minute they go on HRT that's progesterone containing. So you think you've got to the menopause, you think you're through. And I say this as a lifelong acne sufferer, there is a possibility it could come back if you go back on HRT, even though you're the other side of the menopause.
It seems like a really difficult landscape to navigate in the absence of knowing what your hormones are doing, and actually having that intimate relationship with your hormones. And many people have lost that relationship with their menstrual cycle and their hormones, and that fluency with their own body. Um, but I think one of the things that seems to be a recur. I'm trying to scan questions while you to feed you with the questions
Yep.
so we can get to everybody's questions. There are lots of questions there, and I'm really trying to get to all of them. And it's something I feel passionately about is what are the things in our lives that can help as a first port of call, or is not even a first port of call, as a baseline standard, right? So irrespective of anything else that you might do as an intervention, what are the day-to-day things that are like a non-negotiable? So we see a lot more information now about ultra processed foods and how they really mess up our microbiome, our ability to just be healthy. We're constantly there with all of these ultra processed elements in our diet, and that is certainly something that I've seen. I have eliminated some of these things and I feel a lot better for it, but it's hard to do. Are there any other things that you would recommend from a lifestyle, food, diet perspective?
Yeah, so I think from an acne point of view, or just a generally skin point of view, I think a lot of the stuff is taking it back to basics. I don't think it's about buying complex supplements or having some kind of crazy skincare routine. I think a lot of it is actually, making sure you're getting enough sleep. It's making sure that your body is getting enough exercise. And that exercise is a mixture of cardio and resistance training, particularly if you've got PCOS, because there's a risk of insulin resistance, and actually increasing muscle mass is quite important. It will improve your general outcomes
And
from
as you're in
a perspective
perimenopause and menopause, that strength training is
from
imperative.
bone density point of view as well. Absolutely. So it's the sleep, it's the exercise. From a specific diet point of view, I think we all probably know what we should be doing. And that is a diet that has got lots of color, lots of fruit and veg. It's varied. So you're also getting lots of different types of fruit and vegetables in your diet, not looking for the same ones to promote good gut microbiome and good gut health in itself. So I think a lot of it is making sure that you're getting the right foods, not about cutting them out or eliminating them.
Mm.
So for example, for acne, we often hear like dairy is terrible, gluten is terrible, sugar is terrible. So if we just break those down, if you look at most of the dairy and acne data, there's absolutely no doubt that there probably are a small select group of people that are sensitive to dairy, but dairy is a massive food group. So
Mm.
it doesn't mean that if you have blue cheese which is fermented and probably good for your gut, is going to have the same reaction in your skin as having milk, for example, because they're quite different in terms of how they're processed. But if you ignore that small select group that are dairy sensitive, and they probably know who they are because every time they have dairy, they get a spot. For the vast majority of people, dairy does not cause acne. And that's why I have so many vegan patients. If it was as simple as cutting dairy out, like you would not expect that particular group of patients to have them. What we do see, though, is it does seem to be that low-fat dairy or skimmed milk is more of a problem than full-fat dairy. And what we don't know is that because when you remove the fat from the dairy, all you're leaving behind is the sugars and the carbohydrates? And is it then the sugar that's the issue rather than the actual milk and the fats in the milk itself, if that makes sense? Second thing is a lot of people will then switch to oat milk. My problem with oat milk is it's one of the most sugary processed plant milks you can have. It's got a really, really high glycemic index, which means it really spikes your blood sugar levels when you drink it. So a lot of people will swap out dairy, which probably wasn't problematic for their skin, for something like oat milk, which is probably much more problematic from a practical point of view. So it's about thinking about those swaps. So I try and recommend getting people off oat milk. And if they want to have plant milks, then unsweetened soy or almond milk are actually probably your better options from a skin point of view. Now, the one exception I will make is whey protein. And a lot of people take gym supplements and take whey protein. And your average gym supplement with whey protein is probably somewhere between 20 and 40 grams. From a practical point of view, whey protein, it's cow's milk protein, but it's not like having a splash of cow's milk in like your cereal or your cup of tea. It's more like having like 6 pints of dairy. That's a very, very different perspective. So I do recommend that if you take any kind of like protein powders, go for plant-based protein powders rather than whey protein from an acne perspective. So that's kind of my take on diet, increasing the amount of omega-3 that you have in your diet. Always better from your diet than a supplement. 2 to 3 portions of oily fish a week, wild farm salmon, mackerel, sardines. If you can't do that, take a supplement or get plant-based sources. The problem is you need to eat quite a lot of the plant-based sources to get an equivalent dosing. But I think a lot of it, again, it's stuff that we know. There's no kind of like magic kind of, I don't know, solution to what we can be doing. What's good for our skin is what's good for our general health. You know, our skin is an organ just like every other organ system in the body. And the way that we look after those other organs is the way that we look after our skin.
And I think that's so often when I said about us wanting quick fixes for things, it's so often what is overlooked. When we built the health assessment, I know I keep talking about it, but it was such a labor of love over a few years that we asked experts in all different aspects of gynecology. We asked you, what would you put in for skin? You know, all of these different things. And it's because so often when you have an appointment with somebody and that's what you come in for, I have a problem with my skin, you're not asked about all of this multi-layered impact that your stress has on your skin, that your life has, that any medication you might be taking has, that your menstrual cycle, that your hormones, you certainly don't come away from, you know, a routine appointment with a GP where they've gone, right, let's check all of the different what ifs or variables, from lifestyle to diet to stress to hormones to menstrual cycle characteristics to a reproductive pathology or a non-reproductive pathology or an autoimmune condition. And that's really why we're so determined to try and build something that's more diagnostic, that says, right, let's look at all of the different variables that could be contributing to this. It's why I'm also really excited from a research perspective to work with you to say maybe there will be elements about the triggers for hormonal acne or the triggers for dry skin or the triggers for oily skin that we can start to uncover. It may be hormonal, it may be stress, it may be cyclical, or it may be lifestyle related. It could be that it's every single one of those. And so really taking a proper and thorough health assessment is something that actually is beneficial, even from the point of fact of asking yourself some questions. So I've had some people who say, I did the health assessment, I've never actually realized that something might actually impact me till you asked me the question in the health assessment, and it makes you start to think about aspects of your life. And I think we've talked a bit about supplements, and I see a lot of questions about supplements and what ones you recommend. And what amazed me recently when I read Kat Bohannon's book called Eve, and it talked about our use of omegas and how we start to store omegas in our hips and our thighs from our adolescent years. So from a very young age, we start to store all these omegas because we need them to get through pregnancy and breastfeeding. And what the research had shown was that they looked at women who took supplement omegas versus dietary omegas, so that it was in there, it was already in their butt fat. And then they looked in the breast milk to see which of the omegas were present. And amazingly, the body preferentially uses your own fat omegas. So it takes it from your body. It isn't necessarily taking it from any of the supplements. And that was to me like this light bulb moment of sometimes we take them as a band-aid approach, or like, what harm? And actually our body is kind of a well-tuned evolutionary vehicle that knows where to get these things from very often, and it's never had access to 5,000 IU of vitamin D before. And so that was an eye-opener for me, that we can sometimes assume that, you know, supplements are going to be the fix for a deficiency, when in fact actually searching for what the food groups that those vitamins or minerals would be in is actually far more beneficial. People always ask me, what do you recommend? And I'm like, food.
It's a funny one, actually, because I mean, I'm definitely not anti-supplement, like I'm sure you're not. Like, obviously there are life stages where people do need to take supplements.
Yeah.
You know, if you have darker skin types in October to March in this country, you should take vitamin D. If you're vegetarian or vegan and your B12, your iron, your folate levels are likely to be lower, it is worthwhile supplementing those.
Yeah.
I do like recommending myo-inositol 2 grams twice daily for my PCOS patients, because I think there is some good data that shows it can improve insulin resistance and have actions similar to another drug called metformin. But I also totally agree with you that it is always better to get it from your food where you can do it, rather than go for the supplement. Actually think about your diet and how you can bring that into your diet, because our body does not absorb nutrients in isolation. It's how these nutrients work together in tandem. So it's how you might eat that piece of salmon with certain vegetables, with certain fiber, and your body will use all of that together, rather than a singular omega-3 from a supplement and then
Exactly.
exactly, you know, so
Exactly. Or even taking
yeah,
iron. It's like, take iron with a glass of orange juice, because the
yeah,
vitamin C helps the absorption. And I
yeah.
think that's what's sometimes difficult, is like that these do rely on a complex uh, pathway of absorption, especially if we're deficient in one thing, we may be poor at absorbing other elements. Um, a couple of questions have been asked about seed cycling for skin and hormone and gut. Is there any truth to this?
I mean, most of my approach to a lot of this stuff is more of a traditional approach, and I would say that the data probably isn't there. I would always say that if you're going to try something new like that out, you probably do just want to make sure that you've spoken to somebody, you've checked out again the severity of your skin and how it's making you feel, because those are always the two main things that you should start with.
And there are actual clinical definitions, and we ask about pattern as well, and severity of acne too, so that we can get
Yeah,
um, more of a gauge on appropriateness for treatment too.
yeah.
I guess some of the other questions
Yep.
are around, taking collagen and the link with collagen. We know that collagen is linked with our skin and estrogen. Can you talk a little bit about that, please?
Yeah, so there are about 30 different types of collagen in the body, and type 1 and type 3 are the main ones in the skin. And they're also the ones that we start to get a bit less of as we get older. So you lose about 30% of your dermal collagen in the first 5 years after menopause. You lose about 1% per year of collagen from about your mid-20s onwards. So it's what happens to all of us. It's how our skin naturally ages. Now, there are lots of collagen supplements on the market. A lot of the supplements which do exist, the studies have actually been done by the companies that produce them. So I think one just needs to take that with a little bit of grain of salt. There's nothing wrong with industry-sponsored data, but it's just bearing in mind that there may also be a bias that might be introduced as a result of that. The second thing is, if you look at a lot of the data, the sample sizes are quite small. And the third thing is, a lot of the supplements which exist, certainly some of the ones that I've seen, they're not for the right collagen type either. So I've seen, for example, like type 2 and 4 found in your joints. Taking that isn't really going to do much for your skin, but I've certainly seen supplements kind of marketed in that way. If we look again at the overall data on collagen, it seems to be that there isn't really any good evidence that if you take oral collagen or bits of broken up hydrolyzed collagen, you put them in your gut basically knows to send it to your skin and to not send it to another part of your body, because that's the theory. So I've said this before, and I'm prepared to change my mind. If the data gets better, I will eat my hat and say, well, actually, there's a really good study that came out that showed that taking oral collagen is worth it. But collagen's essentially a protein. So my take on this is I personally would not spend my money on oral collagen, but what I would do is make sure that I'm hitting my protein targets, because that protein that I take, some of that will get turned into collagen.
Get me some protein. I always feel quite motivated when you talk. I'm like, "Gosh, I need a to-do list of things things that I need to do." And I guess on the theme of to-do lists, what are your essentials, right? What are your essentials? I know we've discussed that it's essential to know what your hormones are doing, because
Yep.
that's a really good indicator, and actually you're not fighting against something, therefore. So checking what you have in your own reserves is very important first. But in addition to that, what do you recommend?
So I think this is going to sound like a crazy thing to say, probably, but I think there is a real danger of finding a lot of bad information on the internet. And I think if there's one thing that I could encourage everybody to do is, whilst it's tempting to do your own research, just make sure you're doing it from reputable sites and reputable people, because there is so much conflicting information, which is leading people to do things that are actually quite dangerous
Yeah.
and harmful to their skin, or it's delaying diagnoses, or it's leading people to spend an awful lot of money on things that isn't actually going to help them. And it frustrates me no end, as again, someone who's suffered with their skin, that people are being led down the garden path and they're not getting the right treatment that they need.
Those masks, tell me, I see people with them.
The LED masks.
Yeah. Do they
Okay,
work?
so there is a little bit of clinical data that shows that both red light and blue light are anti-inflammatory. So they can have a certain degree or a role in reducing acne, potentially anti-aging. Now, the problem is that a lot of the home devices that we have, for safety reasons, they cannot be as strong as, say, an LED device that you might have in a clinic, for example. And that makes sense. You can't sell people these super potent devices where you might end up causing damage to the eyes or, some other part of the body. So I have about 3 of these masks at home, none of which I've purchased myself. They've all very kindly been sent to me, and all 3 are sitting in the box. So again, this is one of those things where I always feel like, if I wouldn't spend my own money on that, how can I possibly recommend it to somebody else based on the data that we've got? So yes, there is data on red and blue light. No, there isn't fantastic data on home devices and how effective home devices are, because no one's really looked at that. They've just extrapolated from the fact that there's a bit of data on red and blue light.
And I often find that it's so variable, right? Even in even looking at the people's questions that we've seen tonight,
Yeah.
the variance, like in life stage, in whether they have hormonal acne, whether they have just oily skin, then they have dry skin, the difference in people, like it's quite difficult, I guess, for a device or to carry out a long-term study. And this is one of the gripes everyone knows that I have when people ask about hormonal contraception. Does hormonal contraception impact my fertility? And I'm like, which one? Which one? Who has done a long-term clinical study of one group of individuals for a sustained amount of time with a given form of contraception, and actually looked at the outcomes, and then removed the fact that we're all genetically different, we're all exposed to different things, and we're all different ages. So I can see that unless we were to all start doing that, we'll all be round to your house later for
That's right, because that baseline is so difficult, isn't it?
Exactly. Exactly. Okay. I'm gonna just take a look and see, are there any remaining questions that we can get to before we tell everyone good night and I let you go as well. I think the questions relating to coming off hormonal contraception, is this, when people come off hormonal contraception and they see a flare up, is that something that we can anticipate will be a permanent thing, and this is our body returning to what it was pre-pill, or is it a reaction to your hormones all coming back?
It's usually a lot of, for the majority of people, and again, there'll be a selection bias based on what I see in clinic, but for a lot of people, it's often people will put on it in their teenage years because of acne. And we're told, oh, well, you'll need contraception as well anyway, it'll fix both problems. So all that has done over the years is mask that tendency or suppress that tendency, which just comes back when you stop the hormones. I do always say to people, though, give it 12 weeks, that 3-month mark, because it can take up to 3 months for things to settle down after you come off the pill. So if you stop the pill and then, a month later get acne, I would always say just hang fire, because it might just settle down by itself in that 3-month period. But if you're 3 months off it and your skin is still flaring up, I think that's the point where you do need to go and have a chat to somebody.
Yeah, again, I think it's about kind of letting your body get into that. And we even see with different forms of contraception that the return of periods and the return of symptoms tends to be quite different. It can be immediate that your periods return, or it can be eight months later, depending on the form of contraception. So again, it's that what is the specific type for that individual. I'm going to just take a moment to say thank you so much for giving us your time, your expertise, your incredible breadth of knowledge, and to say that we are building a pathway for referral for Dr. Anjali, so that we can really just serve such an unmet need, and help anyone who has gone through the fertility journey, who's received a diagnosis. But even if you haven't, just to be able to say, what are the things you can do in relation to your hormones and your skin, so that we can really build out just more solutions and research and evidence-based solutions. We are always looking for people to engage with us as a research platform, as a data platform. We are launching an app this summer, so please keep an eye out for it. You will have early access if you've done a fertility test. And this really will feed much more into this ongoing story about monitoring your symptoms and looking to see when they're related, but also some of the lifestyle factors that could be contributing to it and the stresses that could be contributed to it. So hopefully it will add to so all of the results that you get from fertility are clinically interpreted, and you have access to a full team of doctors. Soon we're going to have access to this incredible doctor, so that we can really just build out that clinical pathway for people. And we've done so in really trying to listen to all of the data that we have and see what are the most commonly reported symptoms. And unfortunately, at present, within that top 10, mood, depression, anxiety, skin, it's so inextricably linked. And so there's so much that we can all do to just try and alleviate that and learn as we go. So any parting words? Are you going to tell us what skincare routine we do need to do before bed?
Look, cleansing is the most important thing before bed, because our skin is coming into contact with all sorts of things during the day. But other than that, thank you so much for having me. I really enjoyed that.
Me too. Me too. Well, hopefully this will be one of many different series. We, as always, are going to analyze the many questions that were asked and to try and then build out additional results relating to, or webinars even dedicated to specific topics. So I see a lot of questions around PCOS or menopause or dry skin. Maybe it's that we can build out a series that dedicates a full webinar to each of those topics.
Amazing.
Great. All right. Take care.
Thank you.
Thanks everyone for joining.